maternal complications, what all we can expect if the blood sugars are very high? There are chances of the mother going into preeclampsia or pregnancy-induced hypertension. That is, the lady may develop high blood pressure and later go into eclampsia. And if the blood sugars are high in the first trimester, if the blood sugars are very high, there are increased chances of miscarriages, and also there are chances of the lady going into preterm labor, that is before the baby is matured, what we call as before the lady reaches full term. Chances are there that she may go into labor. There can be complications because of the increased size of the baby. The lady may not have a normal delivery, and more chances of going for cesarean section. That if the sugars are high, the baby will develop congenital abnormalities. When the structures or the organs are developing in the fetus, if the sugars are not normal in the mother, that will come in the way of development of all the organs. So the baby may have a problem in the kidney, problem in the heart, or any problem in the lung. Important organs can be damaged because of this. I am Dr. Chandrika Muralidhar. Gestational diabetic mothers are exposed to high risk of developing certain complications. I'll tell first about the maternal complications, what all we can expect if the blood sugars are very high. There are chances of the mother going into preeclampsia or pregnancy-induced hypertension. That is, the lady may develop high blood pressure and later go into eclampsia. So this is very serious complication of pregnancy which we have to avoid. And if the blood sugars are high in the first trimester, that is in the first 3 months, we divide the pregnancy into 3 trimesters, first, second and third. So in the first trimester, that is up to 12 weeks, if the blood sugars are very high, there are increased chances of miscarriages. So I have come across many patients who have had 4 or 5 miscarriages, and then they have come to me, and when I found out that they are having diabetes, then I took complete care of the mother starting from that day till the lady delivered, and I'm happy that I could give a healthy baby to her. So miscarriages are very common, and also there are chances of the lady going into preterm labor, that is before the baby is matured, what we call as before the lady reaches full term. Chances are there that she may go into labor, and even if the labor is not premature, but even at full term also, there can be complications because of the increased size of the baby. The lady may not have a normal delivery, and more chances of going for cesarean sections. So coming to the baby, also there are many complications which can affect the baby. Starting from first trimester, I can say that if the sugars are high, the baby will develop congenital abnormalities. Congenital abnormality means the defect will be seen or will develop from the first trimester itself, and even when the baby is born, this defect will be shown on the baby. So by birth, if any defect is there, we call it as congenital abnormalities. When the structures or the organs are developing in the fetus, if the sugars are not normal in the mother, that will come in the way of development of all the organs. So the baby may have a problem in the kidney, problem in the heart, or any problem in the lung. Important organs can be damaged because of this. And later, as I told you, even miscarriage can occur during any period of pregnancy. After the full term also, if the baby is born, sometimes the baby can be overweight, sometimes the baby can have underweight, that is intrauterine growth retardation also. So overweight babies or macrosomic babies are very common in pregnancy. We call macrosomia when the birth weight of the baby is more than 4 or 4.5 kgs. These heavyweight babies are very much prone to develop postnatal complications. They can develop hypoglycemia. Till then, the baby was exposed to high maternal blood sugars. So once the baby comes out of maternal body. The baby will not have the same amount of sugars which it was exposed. So suddenly the baby will go into hypoglycemia, that is, the sugar level drastically come down. That is very risky to the baby. So we have to keep checking the blood sugars and keep it within normal limits. And the baby can have hypothermia, that is, the temperature can be very much low in such babies, or hypocalcemia, calcium levels can be very low. And sometimes there will be failed lactation, that is, the mother may not get sufficient quantity of milk for the baby, and the baby will be deprived of the mother's milk. So all these complications can occur because of diabetes in pregnancy.